And the next talk is a recorded talker. Okay. It's from Ahmed Zoha from University of Glasgow. The topic is proactive health monitoring and care using AI-assisted intelligence system.
Thank you to the organizers of the workshop, and especially to Dr. Liang Peng for inviting me to deliver this talk on the topic of proactive health monitoring and care using AI-assisted systems. Generally speaking, when we talk about AI-assisted healthcare service, most of us are kind of skeptical, and rightly so. But in my opinion, and this is the argument that I take forward in this talk, is that AI shouldn't replace humans or clinicians. Rather, AI should augment the human intelligence. And in this today's talk, I'll talk about some of the use cases, some of the case studies that exactly um, augments clinicians' intelligence in order to provide more proactive health monitoring and care for the patients. But before I really move ahead, let me introduce myself. My name is Dr. Ahmed Zoha, and I am a lecturer at James Watt School of Engineering, University of Glasgow. And I have more than 10 years of experience, especially the cross-disciplinary experience of designing AI-driven algorithms, particularly for some of the verticals, including 5G and self-organizing networks, smart buildings, and energy efficiency. And most recently, I was involved in projects related to Internet of Medical Things and non-invasive sensing technologies. Over all these years, I've been engaged with um, industry and academia, and I've been part of those multi-million-dollar projects. Um, and with this decades of experience of designing AI algorithms for various applications, um, I must say that the definition of AI has kind of broadened over these years. If you look at the classical sort of definition, the classical definition has taken transition from a fundamental field of study and has moved towards a more mainstream application reason by discovering those hidden patterns within the data. And why they do that for humans, because again, when I say that they augment human intelligence, by discovering those hidden patterns, they're improving the decision making. And ultimately, for businesses there, this leads to an improved revenue. Despite being, I believe that a well-established field of computer science, artificial intelligence, even today, is kind of difficult to have a very consensus on one sort of definition. And there are very numerous definitions that exist today. However, again, in the pretext of health and social care, I find the following definition, which is, by the way, an old definition defined in the proposal for the Dartmouth Summer Research Project on Artificial Intelligence in 1955, to be very much relevant even today. And that definition defines AI to be a cross-disciplinary approach to understanding, modeling, and replicating intelligence, and the cognitive processes invoking various computational, mathematical, logical, mechanical, and even biological principles and devices. And indeed, that interplays with computational science that really formalizes the methods for implementing dynamic, scalable, interactive algorithms. And together, these two, I think, in presence of the adoption and the development in the infrastructure, when the three combines, they define this machine learning a space or an ecosystem. And I really believe that it is mostly credited to the development of the infrastructure because the ability to compute in a fast manner, the ability to have those software frameworks for reproducibility led to the rapid deployment and development of these machine learning systems. And there is an incredible backing by the big tech industry, which puts significant resources in providing these software tools, allowing us to develop these end-to-end AI systems. And especially if you look and we talk about in the pretext of healthcare and AI, I think these big tech companies like Google and Microsoft, they see AI and healthcare as a perfect sort of a marriage. And I believe that is why that there are some sort of major events that triggered the excitement, especially Google's DeepMind entered the healthcare space. There's a very famous paper that really looks at the OCT images from retinal scans and demonstrated that AI systems can produce clinically vetted outputs. They worked with Moorfield Hospital. And then more and more people started realizing the impact of AI and how it can augment the human intelligence. And later on, we see a mainstream advocacy for AI-assisted systems. Notably, there was a very famous report published by Eric Sopol, who looks at how the NHS UK can evolve digitally in the future and how we can enter into a proactive care realm. So we see that there's more of a paradigm shift from a reactive care towards a more proactive care. And I think it has a lot to do with the maturity in the way we started to develop and progress ahead with the analytics of the data. And if you really talk about progressing through the analytics maturity continuum, you'll start to realize that we now has progressed ahead from sense and response side of things to more of predict and act sort of a spectrum. In the past, when the data is more descriptive in nature, giving us the understanding that what has happened in form of reports, and talking about healthcare, the electronic health records, and the other sensory data. But with the emergence of the AI-assisted systems, the advancements in the predicted modeling algorithms and the optimization methods, I like to believe that we have now moved ahead into more predictive and prescriptive landscape. And we now not only able to say what will happen in the future, but what is the best that can happen. This is something that we are aiming to achieve using AI-assisted systems. Now, having said that, again, I like to take my argument forward that AI is not a replacement for human workforce. Rather, it should be seen as augmenting the clinical capabilities. For example, we see that there has been a clinically vetted image recognition systems for breast cancer detection. There has been a lot of research work going on AI-driven algorithms for drug discovery. And with COVID, we see that there's a lot of AI technology being introduced for tracking and identifying COVID patient and symptoms, and even the patients that are at risk for COVID. Um, and the last bit is about, can we predict the deterioration in the health, or can we personalize treatment? This is something that I've worked on personally on a couple of projects. I believe that all of this capability of AI algorithms can actually help achieve an improved health outcomes, and also an improved experience of care while reducing the cost for the NHS. And that's why one of the industrial strategy AI mission report sets the target for UK that they should be transforming the healthcare, especially for the prevention, management, and diagnosis of chronic diseases, with the help and with the use of AI technology. So as a use case study, I'd like to present one of the projects that I worked on in collaboration with NHS Surrey and Borders and University of Surrey. And the project is titled as Technology Integrated Health Management. And this project is mainly focused on improving the care and independence of people with dementia, and also somehow how technology can actually reduce the stress on the carers. For those of you who don't know what dementia is a neurodegenerative condition in which the brain cells starts to die. And currently there are no cure available from a pharmaceutical point of view for dementia patients. The patient or the people with dementia struggle to remember the current events, and the memory loss are one of the most common symptoms of dementia. Other symptoms includes the change of mood, irritation, aggression, and other types of behavior anomalies. And this actually is not only a health challenge for the patient itself, but also for the carer. And you can well understand the scale of the problem by the fact that about 50 million people who are affected by dementia. People with dementia spend thousands of pounds on the care they need, and people affect 50% more expensive than the standard social care. And according to the Alzheimer's Society reports published, around 22% of the unplanned hospital admissions in people with dementia actually are preventable, because they're mostly due to falls, UTI, breathing problems. Care is a very resource-intensive task. And nearly about, there are 5.4 million carers supporting ill, older, disabled family members. And this care burnout is a key reason why loved ones really require admissions to care homes. Also, the carers, and somehow using IoT technology, can provide continuous monitoring 24/7, so that they can live their life in a more independent manner. And somehow the objective is to improve the overall quality of life for the patient and for their carers as well. Connected technology in conjunction with AI to improve the care. This is kind of a bigger question that we're asking. And we deployed this network of sensors within a home across 200 homes in Surrey, UK. Again, in green, blue, and yellow boxes, we perform certain activities, multiple events, and especially in specific times, going out of the house, occupying the bed, go back to sleep, and this can help or pick any abnormal or anomalous patterns. This is what we actually require, especially in the pretext of dementia patients, because we by making sense of the data that we collected over a period of time. Look, the UTI risks for our patients. And early detection of a UTI is very important, or the infection can become a serious health problem. Normally, in a convention setting, the test is done using dip or blood test, and occasionally there's a lot of delay because a patient usually ends up without restlessness, right? So this is one of the integrated views of our system where we generate different sort of alerts, clinical alerts, environmental alerts. But if you click on one of these cards, it expands to each one. False alarm actually started to decrease. Reliability, privacy, and this is one of the and this funded by DCMS, and we're partnered with Cisco and Albine House and Society. The overarching and the question again is that can RF sensing help facilitate switching from hospital care to home care through real-time monitoring of patients? Without putting what we're asking is that if we deploy these systems, and something that we did, we deployed the system in a realistic care home setting in Inverness, in Scottish Highlands, and we wanted to make sure, because we have tested the system in the lab settings, the results look correctly monitored. So can this activity levels really give us that valuable information that we can pass on to clinicians, and they can make some informed decision about it. Some of the results and some of the outcomes of the study is that we actually, within that particular care home, we defined 3 different zones. Corresponds to a person standing, and the promising machine learning model that has given us a activity position identification to about 94%, so we can localize with an accuracy of 94%. We can do occupancy detection with 100% accuracy. We can actually detect the direction of a person moving from the transmitter with an accuracy of 90. We can infer that these RF sensing systems are very sensitive to the environment itself, and they need a calibration phase. And so it's not just plug and play system. They need, and it can actually provide a solution to a very, very big problem for IoT-driven healthcare systems, that elderly specific processes and legislation in place to help speed up the development, deployment, and the use of safe and ethical AI services.